Canada is strongly opposed to this U.S. proposal, and we have made that opposition very, very clear to our American counterparts.
Canada is pushing back on a plan by the states to send American troops to the Canadian border. Good evening, I'm Dwight Drummond. I want to welcome viewers from around Ontario and Quebec and across Canada on CBC News Network. Over the next 30 minutes, we'll take you live to Ottawa, Montreal, and Windsor for the latest local news headlines in those cities and here in Toronto. We begin, however, with the United States. According to the New York Times, our neighbors to the south have now surpassed China to become the country with the most coronavirus cases in the world. And our relationship with them is in the headlines today. Power and Politics host Vashi Kapelis joins us now from Ottawa. And Vashi, the Trump administration is looking at sending troops to the Canada-U.S. border?
Yeah, Dwight, they sprung this on the federal government in this country just a few days ago, and it sounds like it's been just all hands on deck trying to push back. We first learned this morning from Global News, and then the Prime Minister very quickly confirmed that, yes, in fact, the Americans, the White House administration had been floating the idea of and started formal discussions between the two governments on the dispersal of 1,000 troops along the border. And this is a pretty big deal because it's the longest demilitarized border in the world, the border that our two countries share. The reasoning apparently was to deal with the idea of border crossers, so those people who are crossing by foot in between official points of entry. Ironically, the U.S. and Canada came to an agreement last Friday overnight to turn back those people to the original countries that they were coming from. I want to play for you a quick clip that just broke a few minutes ago, the President of the United States addressing this issue. Let's take a listen in, and I'll digest it a bit after.
We have very strong deployments on the southern border, as you know, with Mexico, and we had some troops up in Canada, but I'll find out about that. I guess it's equal justice to a certain extent. But in Canada, we do have troops along the border.
So the president there trying to say, I think, to insinuate that this wouldn't be a major change. It would be. 1,000 troops within 30 kilometers of this border would be a big difference. The federal government, as I mentioned, has fought against this. Deputy Prime Minister Chrystia Freeland, Public Safety Minister Bill Blair, Defense Minister Harjit Sajjan, as well as the newly appointed official ambassador to the United States, Kirsten Hillman, have all been speaking with their counterparts. Have a listen to what the Prime Minister said earlier today about why he thinks it's not a good idea.
The fact that the Canada-U.S. border is the longest unmilitarized border in the world is something that has benefited our two countries and our both economies tremendously, and we feel that it needs to remain that way.
So one interesting point I'd leave you on, Dwight, and that is the difference between the message something like this would send and what materially will change, what tangibly will change. When I asked the ambassador to the U.S. a bit earlier tonight about that, it seemed like it really depends on how many troops there are and where they're stationed. But really, the main point with which the federal government in this country is mad about, upset about, or disagreeing with is just the signal that it would send, that this border, which has been demilitarized for so long, really signifies the relationship, the depth of the relationship between our two countries. And changing the way the border looks would very much fundamentally change the relationship between these two countries, too. And that appears to be what the federal government in this country, while consumed in fighting the pandemic, also is fighting against right now. Dwight?
That would be a big change. Of course, Vashi will have more on this for you. She will be back with Power and Politics at 6:30. Now, let's bring you up to date on the number of COVID cases in the province. Today, a very large jump over yesterday, the largest daily increase so far. The province has confirmed 170 new cases, bringing the total number to 858. There are 15 virus-related deaths, 29 people are in intensive care in hospital, and 8 cases are resolved. There have also been 26,727 people who have tested negative for the virus. As our COVID-19 case numbers increase, CBC News has learned some major hospitals in Toronto are rationing N95 and surgical masks. In some cases, frontline health workers are being told to use just 1 mask per shift. Some hospitals are even putting out calls for donations of protective equipment. John Lancaster has more.
Hospitals across the city say they're doing their best to preserve supplies while still protecting frontline workers and the public. Nurses like Pam Parks aren't so sure.
We feel like we're disposable.
For more than a week at Lakeridge Health in Oshawa, Parks says staff didn't have access to N95 masks while treating COVID-19 patients and those suspected of carrying the virus. The masks give increased protection from droplets spread by infected people. Instead, Parks says they were told to use less protective surgical masks. As of yesterday, staff were getting the N95 masks, but the supplies are being monitored closely and kept under lock and key.
I'm pleading with the Ontario Premier to please provide the funding, order these equipments, get them in, and provide it to the hospital and protect the frontline workers.
Today, Ontario's Minister of Health said this.
We are working at procurement 24/7. We know that we need to get more supplies. Ontario companies are stepping up in great numbers to help us.
But for now, shortages remain. Michael Garron Hospital is one of several across the province asking for donations of protective personal equipment. A few blocks away at Bridgepoint Health, frontline staff are being issued just one surgical mask a day. The facility says it needs to balance safety for staff and patients while conserving masks.
They talk about social distancing,
Therapist Paul Jansen worked through the 2003 SARS outbreak, where healthcare workers made up almost half of all infections due to the lack of proper protective equipment.
kind of do have a roadmap on how this is going to play out, not just from things like SARS, but because it's kind of hit other countries in very drastic ways.
The Registered Nurses Association of Ontario says frontline healthcare workers are at war with COVID-19. Already, at least 6 nurses in the province have contracted the virus. How is still under investigation. John Lancaster, CBC News, Toronto.
The backlog for COVID-19 testing in Ontario continues to grow. Today, the number of cases under investigation has doubled from just 1 week ago. This comes as the province promises to expand testing by the end of the week. Lisa Shing now with the latest.
After returning from a work trip to Las Vegas, Hamilton resident Jason Kuplin came down with symptoms similar to COVID-19.
I had everything but a fever, so then on Friday I checked my temperature and I did have a not very high, but still a fever.
He got tested at a clinic on Sunday, but almost 5 days later, he still hasn't heard back.
It's a frustrating spot, but it is what it is. It feels like we're slower getting results back, but I'm not worried about it. I know they're trying.
Today, Premier Doug Ford said expanding the province's capacity to test for COVID-19 is a priority.
We're at war right now, so we have to make sure we follow procedures, but no more waiting around.
That's as the number of people waiting for results has ballooned to almost 11,000, double that of just 6 days ago. So far, the province has also done more tests than before. Today, it was about 2,500, but it's not nearly enough to keep up. Health officials say Ontario is on track to complete 5,000 tests daily by the end of the week and ramp up each week after that. By April 17th, the hope is to do 18,000 tests per day.
We are ramping up, utilizing everyone possible.
One of the problems is a short supply of reagent, a compound used to process the samples. Another is that new labs have to pass a quality control test.
Every time you open up a new lab, the first 50 samples of all those new ones have to be repeat tested at Public Health Ontario.
Until they can process more tests, Ontario is prioritizing health workers, people who have traveled, and those who are vulnerable, which means we don't necessarily have an accurate picture of just how widespread COVID-19 is in the community. Lisa Shing, CBC News, Toronto.
Let's head to our nation's capital now. Omar Dabagi Pacheco is live in Ottawa. Omar, what is happening in your city today?
Thanks, Dwight. Yeah, things changed so quickly. Yesterday when we spoke, there were no new cases in Ottawa, and then later that evening, we found out about the first COVID-19 related death here in Ottawa. That was a 90-year-old man, no travel history. He was living at home, came down with a fever about 10 days ago, and then passed away. And that's just how quickly things are changing here. The latest numbers from today, 5 new cases here in Ottawa. That brings our total to 32. And just across the river on the Quebec side of the National Capital Region in Gatineau, the total over there is 16 today. Now, these latest numbers officials keep reminding us are not the real number we should be looking at. The real number is likely in the thousands in the National Capital Region. And if there is some good news, it's, look around. I mean, this is downtown Ottawa. This is typically a bustling time of evening, rush hour, no one on the streets. That is a good thing. People are self-isolating, they're staying at home, but that's raising other concerns, especially for police. As businesses have shut down, they've closed their doors, police have increased their patrols in an effort to curb what they believe could be an increase in commercial break-and-enters. As the pandemic turns Ottawa's streets into a ghost town, Ottawa police say they're increasing their patrols, keeping an especially close watch on businesses that have had to close their doors.
We're talking about streets or a neighborhood where there are a number of restaurants. It could be a combination of restaurants, could be a combination of businesses.
Those same businesses have hired extra help. The Happy Goat Company may look like it's a sitting target for looters, but Guy McGrath is making sure that people know he's around.
We're doing anything we can to try and keep some lights going on and off, and some traffic in some degree for sure. The business owners, I think, just by insisting on having me stop by from place to place every day, this is my second cafe I stopped by today, and I've got a few more on the list they're hoping I'll get to today.
Ottawa police say that is a smart move.
It's somewhat of a crime of opportunity because someone who would have an intent to break in or to cause mischief, they don't have that fear that somebody could be maybe cleaning overnight. Somebody could be doing the books.
Gatineau police are worried about the same thing. But despite the number of break-ins, including this one last night at the SAQ on Saint-Joseph, they don't believe there has been any kind of spike. They say the extra patrols are just proactive measures in very difficult times. Other industries are worried about theft too, like construction sites, some of which have installed state-of-the-art security cameras. Monitoring those cameras is one of McGrath's new roles.
All of our job sites, we shut them down as of last Wednesday, fully and completely. It goes directly to my cell phones. I get alerts night and day, even of people walking their dogs on the front lawns of the places.
And for shops who don't have that kind of technology, police are asking the public to lend a hand.
If you see anything, please call us. We need everyone to help us, to be our eyes and ears out there. And so we're just asking people to help us out as well.
And this is something that police forces across Canada may have to think about. Police here have some tips for business owners if they're in that situation. Make sure your alarm is active. Also, take any merchandise you have off the displays if your store is shut down. And if you have a cash register, empty the till and leave it on the counter somewhere visible so that would-be thieves can think twice about wanting to break into your store. Dwight Fernandez, back to you.
Yeah, good advice. Thank you, Omar. The family of a Second World War veteran is sharing his story after he died of COVID-19 on Tuesday. Zama Rosenberg was 100 years old. He was born in Ukraine, enlisted in the Soviet Red Army, and fought the Nazis in Germany. He came to Toronto in 1991. His family says he was admitted to the hospital with shortness of breath on Friday and tested positive for COVID-19. We spoke to his daughter and grandson earlier today.
He has always been a hero to me, and he showed me the way on how to be a real honorable man and champion in life, and to also be humble.
My father was without any education. He finished only 1 grade at school. And after that, life was so hard for him. But he raised us, 2 daughters, with all his love.
The family couldn't visit him while he was in the hospital, which they say was one of the most difficult parts. They held his funeral in an online video chat earlier today. Seniors are among the most vulnerable to becoming seriously ill from COVID-19, and already in this outbreak, there have been a number of deaths in seniors' homes in the province. Alicia San spoke to a man whose mother lives at one of the homes where a resident died.
2 cases constitutes an outbreak, and from what we know so far, at least 5 seniors' homes in the Greater Toronto Hamilton area have experienced outbreaks of COVID-19. 2 deaths have been reported at Seven Oaks in Scarborough and a death at Hillsdale Terraces in Oshawa. So I've been following this story and I came across Bruce Townley, whose 92-year-old mother lives at Hillsdale. That facility is under complete lockdown right now. As you can imagine, he's really concerned about her well-being. We're going to reach out to him on Skype. He's in Alberta.
Unfortunately found out via the media and not through the normal channels that you would expect from from the facility. In the media indicated a 92-year-old female had been confirmed, and coincidentally my mother is a 92-year-old, and so we didn't know.
5 other residents have tested positive at Hillsdale, and 28 residents are in isolation, including Townley's mother. How's your mom doing?
She wasn't allowed to leave her room. I had a conference call with somebody in the home, and as of then, my mother still has not had a proper shower now for the better part of 8 days.
Staff at Hillsdale have reported their own concerns to the ministry over a looming shortage of personal protective equipment like masks and gowns. According to Durham Public Health, long-term care homes with outbreaks are at the same priority level as hospitals to receive more PPE in the coming weeks. In the meantime, for Bruce Townley's family,
the communication has to get better, both with the patients, both with their immediate families, and the public for that matter.
Ali Chiasson, CBC News, Toronto.
2 major automakers have announced they are extending their pause on production. Big news in Windsor, where thousands of workers have been already laid off. We're joined now by CBC Windsor's Chris Ensing. And Chris, how many auto workers are we talking about now?
Yeah, when we look at both Ford and FCA, as well as their feeder plants, it's close to 9,000 people. Both FCA and Ford say that that pause on production was supposed to last until the end of the month, but neither are in a position to restart come next week. FCA is our largest employer here in Windsor, Essex. They're being told that a likely restart is on April 14th. Ford is putting plants online in the U.S. first, but the engine plants here won't start until April 20th. A big concern for the union leaders that I spoke with was keeping their workers safe.
That's just it. The company is going to do what they can to make it as safe as possible. I just discussed a deep clean, but and they're gonna have supplies in each area to make sure the place is clean. They're ordering more supplies, like masks, like shields, to protect people that are going to be working within 6 feet radius. But that doesn't mean that they will be entirely safe. That's the dynamic we have right now.
The other dynamic here in Windsor, Essex, with everybody being laid off, is the stretch that's putting on the food banks. Fewer donations and more people asking for help. Enter the Windsor Islamic Association. They've been able to set up a helpline, primarily for seniors. The idea being you give them a call and they'll get into action like this, providing food and hygiene products for those who need it. There's 30 volunteers. If they don't have what a senior needs, they'll go out, shop for it, and try and get it to them. All of this being done as our community tries to lean on each other during this pandemic. For more on stories like these, our local audience can go to cbc.ca/Windsor. Dwight?
Chris. Let's head to Quebec now. Host of CBC Montreal News at 6, Deborah Arbeck joins us live with the latest from there. Deborah.
Thanks, Dwight. Quebec's premier is calling for a wave of solidarity. François Legault appealed to Quebecers who are able to volunteer their time to help those in need. Legault responded to a question from one business owner who asked how that jives with shutting down so many businesses to keep people at home.
Right now, we have people who lost their job. They don't have the money to get some food for their family. So what I'm asking Quebecers is to please help, if you can, to deliver food to the people that don't have money to buy food. So I think there's a difference with a non-essential business for the next 3 weeks and feeding the population.
The province has launched an online portal for those who can help. It's at jeubénévole.ca. This afternoon, though, it was overwhelmed with hits and crashing, so you may have to be patient. Keeping the people who work on the front lines healthy is becoming a big issue. CBC News has heard from nurses who say hospitals are running out of masks. There are stories of doctors using acetate sheets to make their own face shields. Nancy Wood's in our newsroom tonight. And Nancy, what did the head of public health have to say about this today?
Well, Horacio Arruda said there are 46 healthcare workers who have tested positive for COVID-19, but he said there's no evidence they caught it from patients in a hospital setting. They may have been traveling, for instance. The Premier and Arruda have both said they understand that healthcare workers are worried and they want to be extra safe. And they say there are enough masks for all healthcare workers who need them, but that they have to be stored and used judiciously by only those who are in real danger of contracting the virus. If there's any case where workers can't get the equipment, public health says they want to be notified. Here's the head of public health.
There is a strict management of that because we don't want to be in a situation that in 3 days there is no more mask and we cannot protect the emergency people who see that. But it's clear that even in an hospital where there was masks before, they have been taken away from those places where we'll not have exposition right now to be used in a safe way. It's a tight management because the resource is crucial, but we must use it where it is to be used as recommended by our experts.
Now, the Premier says the province does have enough medical equipment like masks and ventilators for the next few weeks if they are used carefully. They can also move supplies from one hospital or region to another. And Deborah, they've ordered supplies from Quebec companies and overseas, from China, for example, which is starting to get back to normal now with fewer cases.
All right, thanks so much, Nancy.
You're welcome.
Now, by contrast, there are 290 new cases of the virus in Quebec today. That brings the total to 1,629. 8 people have died now. That's one new death. 106 COVID-19 patients are in hospital and 43 are in intensive care. Testing will be stepped up in an area of Montreal that's seen a big cluster of cases. 42% of the cases on the island of Montreal are in the west central part of the city. This new testing center is being set up in the parking lot of Cavendish Mall in Côte Saint-Luc. Quebec's Director of Public Health dismissed the idea of more measures targeting that area. We're learning more about the first person who died of COVID-19 on the island of Montreal. Sarah Levitt joins me now. And Sarah, the man was a member of Montreal's Hasidic community.
Yeah, Deborah, and I found out that the 67-year-old man, started having symptoms on Sunday, and it went really badly from there. Tuesday, his family brought him to the Jewish General Hospital. Wednesday morning, he was put on a ventilator, but by Wednesday night, he had died.
His family is shocked, the community is shocked, everyone is shocked. You know, when it hits home, they've been forecasting how vicious this virus is, and when it finally hits home, it's sobering. It's a stronger wake-up call that we need to redouble our effort.
A private funeral was held for the man in a Jewish cemetery outside of Montreal, just his immediate family, but members of the community could call in to take part. But Deborah, it's a far cry from the normal celebration of life that's held when someone dies in the Hasidic community.
All right, Sarah Levitt live tonight. Thank you, Sarah. The Public Health Department in the Eastern Township says 10 of its own staff members have tested positive for COVID-19. That includes the region's Director of Public Health, Dr. Alain Poirier. He's currently in isolation. Officials say they're tracking down anyone who may have come into contact with the employees. They say services should not be affected. The Premier calls them our guardian angels. The current situation has placed a lot of responsibility on the shoulders of healthcare professionals. So how are they holding up? Simon Akonechny caught up with one nurse working at the outdoor testing center in downtown Montreal and put this together.
Well, everybody's a bit tired, but we're trying to keep things up and keep testing people as many as we can, so be effective as well. So we're going to get through this. We're nurses, so everybody's in a good mood. We're trying to, make sure everybody's okay, answer those questions, try to do it with reassuring voices. I guess that's what we're trying to do here. I have a husband and 2 kids, so we're taking every precaution that we can to make sure that they're safe. Well, we all chose to do this, so I'm pretty confident that I'll be able to protect my family from this. We have a very strict protocol at home. So by taking my clothes off outside, by washing everything. So really we're doing what it takes to keep everyone safe, to contain this. We're very educated here in Quebec, so I'm confident that we'll be able to protect everybody and keep everybody safe through this crisis. Stay home. Stay home. Don't go out. Social distancing. Be as far as you can from other people. And it's going to flatten the wave.
Thank you very much.
Awesome. Enjoy your day.
And drawings of rainbows have been popping up across the province with the message, it will get better. Montreal police are also doing their part to stay optimistic. They shared this photo of some of their officers keeping that message going today. Well, that's what's happening in Quebec right now. And Dwight, before we get back to you, we just want to let our viewers know that as of tomorrow, the full 30-minute CBC Montreal newscast will be back on the air on our local CBC station at our regular time at 6 o'clock. Dwight?
Your viewers will be happy to have you back. Thank you, Deborah. Back here in Ontario, Premier Doug Ford had some tough words for upscale Toronto grocery store Pusateri's, which was apparently selling Lysol disinfecting wipes for $30.
I have zero tolerance for price gouging. I'm calling them out. Pusateri's. I hear that they're selling hand wipes for $30 a tin. That's disgusting. Absolutely disgusting. A company like that would be selling hand wipes for that cost. You know something? I can't even.
Pusateri's has apologized. Thank you for joining us. You can find us back on CBC Television.
Nora and Jay shopped for their home insurance in just minutes. Rick found the cheapest car insurance rate online. Do they have the right coverage? Before the quote, get expert advice. For home, car, or business, talk to an insurance broker first. Visit beforethequote.ca.
COVID-19 is a serious public health threat. All Canadians must act now to reduce the spread. Protect yourself and others, especially those with medical conditions and older adults. Wash your hands often. Avoid touching your face. Cough or sneeze into your arm. And stay home as much as possible. Now is the time to act, and we must act together.
A message from the Government of Canada.
What if your skin could light up the room?
It can, with Aveeno Positively Radiant Daily Moisturizer with active natural soy. Gives you healthier looking, more radiant skin in just 1 week. Aveeno.
Naturally beautiful results.
Wrinkles. They're so last week. Neutrogena Rapid Wrinkle Repair works so fast, it takes only 1 week to reveal younger looking skin. Pair with retinol oil for 2 times the wrinkle fighting power. Neutrogena.
So I'm gonna hold on promoting you this quarter. Cool?
Drop the taco. Get in the car. Does this Sentra feel like a compromise to you?
Wait, what?
The handling, it's good, right? No compromise there.
Nope.
Watch this.
Breathe. Rear automatic braking. So if this Nissan Sentra isn't gonna compromise, why should you?
You're right.
Atta girl.
The all-new Nissan Sentra with more standard safety features than any other car in its class.
At Rogers, we believe in the power of youth. It's why we created Ted Rogers Scholarships to support more team builders, more community leaders, more difference makers. With Ted Rogers Scholarships, now in its 3rd year, we're continuing our commitment to the next generation so they can reach their full potential and create a future where anything is possible.
TD Insurance, you could save when your claim's free, which is great if you're a safe driver. Not so much if you're a tow truck driver. You could save up to 30% on car insurance when your claim's free. Feeling good about saving when you drive safe. That's what